Hello, everyone, and welcome back to the Born to Heal podcast. Today, we are having a special episode called Ask Me Anything. And I have Jess Bubico here with me, who is going to ask me the questions and then also facilitate a conversation about these questions that have come up from listeners from the podcast. And also we've had some questions also on Instagram. I wanted to do some of these episodes so that we can make sure we're getting your questions answered. And so here we go. So Jess, you want to start us off?
Yeah, absolutely. Thanks for having me here. Okay, so the first question is, what is your opinion on biopsies?
Yeah, so this one is interesting because, right, in the Western medicine space, it's like, well, of course you're going to do a biopsy. Like, why would you even be having this conversation? But the reason why this question is coming up is because there are people in the more holistic space who believe that cancer is basically an accumulation of, toxins or abnormal cells. There's actually a couple different different theories on this, but basically that it's our body's way of encapsulating things that are problematic for the body, and that you're basically have this contained system that if you put a needle in it, then it's potentially going to release the contents of this trash, for a better word, that your body has encapsulated and to have it spread. Okay. And from the Western medicine perspective, let's just take breast cancer as an example. So the idea of biopsying a breast tumor, most Western doctors would say that's not true, that biopsying a breast cancer doesn't seed anything else. There's, no risk of spreading the cancer from that biopsy. But there are certain types of cancer within the conventional Western medicine space where they will say it's problematic. And actually sarcoma is an example of that, where if they go in and they do a biopsy, there is data showing that you can seed the tract. And then if you're going to have it removed, you need to make sure you remove that tract because there can be seeding. So within Western medicine, even though most of the time they'll say this is not an issue, there are some cases where they say, yeah, maybe, doing a biopsy has the potential to be seeding another area. But in terms of like generally this idea, so this is a question that's coming up a lot, because if you think that cancer is this packaging of trash and that putting a needle is potentially going to make it spread, we don't have good data to say that that actually happens. But I think this is something that for me personally, I say this all the time on the podcast, like, I don't know what is best for your body. And so I always tell people, trust your intuition of what feels right for you. And a lot of my clients decide that they want to have a biopsy because they want to know for sure, is this cancer, and have that information. And I don't want them to be afraid that, oh my gosh, if I do that now, I've ruined everything. And this is basically making it spread, because I don't have clear data to say that that's the case. And then I also have, other clients who are like, I don't want to biopsy. And this is a decision that I'm making, and I also respect that. And so I don't want people to think I'm like just wishy-washy in this way, but I really don't think that it's black and white. And I really believe that it's a personal decision that each person needs to make. And if you feel like having that biopsy, having that information is really important for you to make decisions, I think you do it. And you don't worry about it. And then if you don't want to do it and it doesn't feel right intuitively, that you follow that guidance and you are comfortable with that. And I think this is part of the thing that I find myself challenged with in the space of cancer, is there are so many opinions of people saying, this is absolutely correct and this is absolutely not correct. And I will tell you, as a professional who has practiced oncology for 20 years now in the conventional space, in the conventional space for 20 years, and then now outside, I don't even know what cancer is. Like, I am finding that a lot of the things that I was taught were not correct, and I'm still trying to figure it out. So these people who tell you they know exactly what it is, I don't believe them. I don't believe that anybody knows really what's going on here. I have some theories, and actually we're going to talk about that when we talk about a couple of the other questions. But I just want to say that when someone makes you feel bad for a decision that you've made because they say they know what cancer is, I would question that. I would question them more than I would question your intuition about what you feel is right for your body. And so that's my answer for what are my opinions about biopsies. And I don't know, like, if I had a growth, I don't know if I personally would do a biopsy, and that's the most honest thing that I can say to people is I'm not sure what I would do, and that I would have to sit with, what I would do. I think the things that you want to think about are, what are you going to do with the information? Is it going to inform your decisions about what you do? Is it going to help? Is it going to stress you out? I think that all of those pieces you want to think about as you make a decision about whether a biopsy is right for you.
As you were talking, I was just thinking to myself, it's so easy to want to look for the person that's going to give us a level of certainty when we find ourselves in a space of such uncertainty or facing an unknown. So I think that's, some really great perspectives to consider. So what is your opinion on screening for cancer?
I want to start this question with explaining that I'm qualified to answer this question. That, not only did I practice radiation oncology, but I also was on, screening guideline committees for nationally for breast cancer and for lung cancer. And so I understand the principles of screening. And the idea is that you screen a population for a condition and knowing that there's risks associated with the screening, right? So if you're screening with mammograms, there's a certain amount of radiation that is given, and that by doing mammograms on, 100,000 women, you're going to have a certain percentage that can develop a cancer related to that screening mechanism. And the idea behind screening is that you want to make sure that the benefits of the screening outweigh the potential risks of the screening. But that's on a population level, right? So you're not looking at you. Like, if I was talking to you, Jess, about having a mammogram, the statistics and the risk benefits is like more at a population level. For you, if you have screening mammograms and then you develop a cancer, that's 100% for you, right? But then there's all these other people that they may never develop anything from having those screenings. And so when you're looking at the risk benefits, it's looking at it from a population standpoint and what is the overall risk benefit to that group of people and not necessarily to the individual. But we need to make decisions as individuals, right? And I think about the statistics of cancer today as I think about screening. So I believed in screening. Like, I was in charge of programs that did screening, And so I'll start by saying I have stopped doing any screening myself. But I have also completely changed my lifestyle. I am not living the standard lifestyle that now results in 1 in 2 men and 1 in 2 women developing cancer in their lifetime. I think that when we have statistics like that of 1 in 2 men and 1 in 3 women getting cancer in their lifetime, then screening potentially can maybe catch people in an earlier stage of disease. And that's the whole idea, that you could catch something earlier. But, just over 100 years ago, our rates of cancer were like 1 in 33 people would get it in their lifetime. And now we're at 1 out of 2 men or 1 out of 3 women. And so if we can do the things with changing our lifestyle to get us back to that lower risk, then we don't need to be aggressively screening everyone. But if you are living the traditional lifestyle, then, I don't know, maybe screening makes sense. But I do think that there is a misconception about cancer, and that we know that people who have, let's just say, prostate cancer, so low risk prostate cancer, you could detect that on screening, but it's never going to kill them. It's maybe never going to cause problems, but you could subject someone to, unnecessary distress from having the biopsies, having a diagnosis of cancer, then undergoing treatments that cause impotence and urinary incontinence, and like all kinds of ramifications of treatment of a disease that maybe was never going to cause problems in the first place. And we know this is an issue specifically with prostate cancer, breast cancer. Switzerland came out with, guidelines saying that they're not recommending mammograms, for a reason. And so I think that for me, the screening is coming from this astronomical rise in rates of cancer. And, I don't think that the doctors or the programs that are putting out screening are trying to do anything but good. But the problem is we're missing the point. The point is that we're getting sicker as a population, and that we wouldn't need screening if we would start to change our lifestyle to become more healthy, to be getting the nourishment that we need to make sure we detoxify ourselves. And basically, you just need to listen to my podcast, and I talk about all these things that we can be doing. But since I've made those changes in my own life, I have personally made the decision that I won't be doing mammograms, that I won't be doing pap smears. And I'm not saying that that is not something you should do. I think this is a personal decision, but I think you need to think about how are you living? And if you really want to lower your risk of getting cancer, or you want to, catch it earlier, whatever that is, the real way to do that is to start working on prevention and getting your body healthy so that it's not conducive to growing cancer. And we know that the modern lifestyle is making us more susceptible to that. And so that actually ties into the second question after that, was screening for cancer and mammograms. So that ties into the question about mammograms, because mammograms are a screening tool. So those are my thoughts on that.
Awesome. There were two questions I was going to actually follow up to this with. So it sounds like you kind of answered that first one, which is you referenced screening if you've changed your lifestyle, which is why you've chosen to stop doing screenings for yourself. And so it sounds like your 6 pillars that you talk about on the podcast could be a really great resource and reference for people to start maybe assessing their own lifestyle and how they're operating, and maybe start to find some alternatives to how they can work on that prevention piece. So
yeah, absolutely. So in addition to all the free content that I have on the podcast, I have a workshop series called The 6 Pillars of Healing Cancer, but it's basically also preventive. All of those pillars are related to how we just fortify our bodies to become healthy again. And so that workshop series, which is just $198, is a great way for people to, if they wanted to know, okay, what should I do then if I don't want to screen and I want to change my lifestyle? What are the things that I can do? And that would be a great place to start, for sure.
I think too, the way that the Western world kind of operates and the way that we look at success, maybe like traditional success in the way that we traditionally run our lives in the Western world, it might be interesting to go and listen to some of your podcasts or take that workshop series so people can actually really look at health from a completely different way that might be even different than what you've been taught in sort of from the traditional Western perspective.
Absolutely.
You have a question here about, is cancer genetic? But I also want to say with your question, a question about screening, I can see someone potentially saying, okay, yes, and my mom had breast cancer or my dad had prostate cancer. Like, is there a recommendation recommendation potentially that if somebody has it in their family line, that they would want to potentially consider screening? Because I think people talk about screening more when you have it in your family. And I think that also bodes the question of, is cancer genetic?
Let's start with, is cancer genetic, and kind of talk about that. And then we can address for people who have known mutations or clear cancer running in their family. So, this actually, if you sign up for my, just on my website, I have a guide, the 3 things that you need to know about cancer. And I go into this about genetics, but most of us are taught in oncology that cancer is a genetic condition, that, DNA mutations are what lead to cancer, and that those can be passed down in the family. But the truth is that only 5 to 10% of cancers are genetically related. 90 to 95% of them are considered sporadic, meaning that it doesn't run in the family. It wasn't passed down through heredity. And so it's a very small proportion that is genetically related. So that's the first thing, is like cancer. There are some cancers that are genetically related, but the vast majority are not. And even when you have a family member who has breast cancer, let's say, so say you had an aunt who had breast cancer in her 70s and it was estrogen receptor positive, it's very unlikely that that is a genetic thing. That's just the 1 in 3 women now, developing cancer in their lifetime. It's more like if you have someone like let's just say with the BRCA mutations for breast cancer, ovarian cancer, it's like having young relatives, like a first degree relative, like a mother or a sister who had breast cancer in their 30s and 40s, younger than 50, or having ovarian cancer in very young ages. So they tend to be younger, more aggressive cancers, not always, but generally. And so if you had that scenario, oftentimes if you had, first degree relatives who are diagnosed at a young age, oftentimes they're getting genetic testing. So then they would know if they have a mutation. And if you have a known mutation in your family, then that's something that you can get tested for to know if you're predisposed to that. But even when you have the mutation, it's not 100% that you're going to get that condition. And it comes back to the lifestyle. It comes back to the way that we're living. And so even if someone has a genetic mutation, it is not a sure thing that you are going to get that type of cancer. And there are a lot of things that you can be doing short of removing all your organs that, could develop cancer, like mastectomies and oophorectomies for people with BRCA mutations. I'm not saying not to do that. I'm just saying there's a lot of things that you can do to lower your risk, even with a mutation. But I do think that screening makes more sense in that setting with someone who has a mutation and they're wanting to know. I think that in that scenario, especially if you're choosing not to do the aggressive surgeries to remove organs that may be at risk, a more moderate approach is to make the lifestyle changes, do everything that you can. And then maybe in that scenario, screening makes sense, right? Because the risk of developing that type of cancer is higher, but these are very small numbers. This is not the majority of people that I'm talking to on my podcast. But if you fall in that category, I absolutely understand, doing screening under those circumstances to catch something earlier if something were to develop. And, and I think about that for myself. I'm like, I don't know, if I had a BRCA mutation, would I be doing mammograms and MRIs? And I don't know. I don't know the answer to that. And so I think that it's just one of those things that, making individual decisions and trusting your intuition, but it's not all or none. Like when they tell you you have this mutation, so you have to have all these organs removed. Absolutely. I don't think that is necessary. And then, but I think screening's kind of like a intermediary in there, is like maybe that'll give you some peace of mind, make you feel better. And I think that you do what makes you feel comfortable and, feels aligned for yourself.
Yeah. I'm going to do a little plug for you in this moment, because I feel like this is one of the important parts of having someone on your team. I know that through your work, you kind of act as a guide that somebody can come and talk to about their decisions. So I feel like having a neutral teammate on your team who can help you really process through, especially, you had mentioned it's not when someone potentially gets a cancer diagnosis, you're not just dealing with just the cancer diagnosis, you're dealing with potentially how family members might feel, or what doctors might be saying, or what you maybe read or heard as you're searching through literature. So I think having somebody on your team who can support you and guide you and act as that neutral guide when emotions might be rising, or fear or confusion, to come back to yourself is really important. Because like you've said many times, like it depends, there's not necessarily a clear-cut answer.
Yeah. Well, and that is, so in my consults, I really kind of do three things when I see people one-on-one. One is this, decision support, like coming alongside you. I have the medical background. I can help you make sense of the statistics that your doctor has given you. I can also give, alternative perspectives and just help you make sense of those things, and then put it into context of your lifestyle, your values, what's important for you, so that you can make the best decision. So that is part of what I do. And if that, if someone feels like they want more personalized guidance on the decisions that they need to make, absolutely, that's something that I love to do. And it's, it's a privilege to help people navigate through some of these decisions, because they're not easy and they're not clear cut, and it, like you said, it depends.
What are some of the common things that you see someone see happen within someone when they are going from not having a cancer diagnosis to having a cancer diagnosis, meaning like emotionally? Do you ever find that there can be like an outsourcing of decision making, or like, and what do you see happen through that cancer journey around like people pulling their power back, having to learn to make decisions for themselves? Like, what are some of the common emotional things that you see happen when people receive a diagnosis?
Well, I think that number one, fear comes up for everyone because of just the whole, like cancer itself is such a loaded word in our society, and that it's many people's biggest fear. And then also they think that that means like, oh, I'm going to die. And so there's just a lot of fear that comes up, which I think is just normal given everything that surrounds cancer. But the other thing that comes up for people is there are dynamics that develop within your like nucleus of whether it's your family or your close supporters, the people who are closest to you that you share about the diagnosis. Oftentimes there are differing opinions about what you should do. And so I see this quite often where there's someone who has had a diagnosis of cancer themselves, and they feel quite clear in their own knowing of what's best for their body. And maybe it's different than what the doctor has recommended, but they have a family member who's like, why would you not just do what the doctor recommends? Like, I hear you that you feel like this is not right for you, but this is not the time to just like go with your intuition. Like, we should just do what the doctors say. And it can be really challenging for people to get clear for themselves when they have differing opinions. And actually, you might have like one family member who's, off in one direction, another one in the other direction, and pulling equally. I mean, sometimes people are like, don't do anything those doctors say. Like, I wouldn't walk in a medical office if you like paid me, And so there can be this like pulling. And so I think, this is another place where for me with my clients is like, I come in as like a neutral person to, I am with you, whatever that means, and also help you tease apart what are the pieces that are coming from within you and what are the pieces that you're feeling influenced from the outside. And also it's important, like the people that we love, they want us around. So oftentimes these dynamics are not out of a place of, malice or anything. Like they love you. They want you to be around. So they are, like they have their own fear. Right. And so I think the big thing is it's quite common for the decision-making process to be a little bit confusing with other people's ideas and thoughts in there. And then also the doctors, the doctors can say something. The treatment regimens are quite protocolized, where it's like, you have this type of cancer with this receptor status and this, blah, 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 this stage. It's like, you're getting this treatment. Like this is the algorithm. And the doctors, that's how we're trained to practice, right? And the guidelines, like that's actually, what we're judged against in like the standard of care. But if that doesn't feel right to you, that also having the doctor who is an expert, right? Who's like, this is all they do. And then, but your intuition is saying no, that also can like, unnerve you. And so it's just, it just recognizing that your power comes from within and that you want to make the decisions out of information, like accurate information and clarity and groundedness, and not out of a place of fear. And the one thing that I see a lot of people do is they make decisions. They're like, well, rather than fighting with my husband about this and like whatever. And also if I don't do the treatment and then it comes back, then I'm going to be like, upset that I didn't do it. So it's just easier just to do it. And like, that's the path of least resistance. But these are really big decisions and they have long-term consequences on your body. And I see it after the fact, people regretting doing something because a family member wanted them to do it. And that's what I don't want, is I want you to make the decision so that down the road, you're like, you know what? It was a hard decision and I really struggled with it, but I know that I made the decision aligned with my values and what was important for me. And so I think that's the part of like bringing back our power. And sometimes that requires standing up to the people that you love or your doctor and saying, I understand how you feel and I understand what you're saying. And that's not the right path for me.
Yeah. I love that. And I love I think something that's kind of coming to my mind as you're talking, and I think you're probably the first doctor that I've like actually known and had a personal connection with, besides, my OBGYN that I loved when I would go see her once a year. But I think there's an element of like, your doctor is human, like it's easy, I think, as a patient to walk into a room and say, well, this doctor knows everything. But your doctor is a human on the other side of you as well. And, if you look at medicine has changed a lot over the last 100 years. We're not giving the same treatments that we even probably gave 5 years ago, because we have trials and we learn and we evolve and things change and they go, oh, okay, well, that didn't work the way that we thought it did. So I think it's also important to remember on the other side that while it might seem like, the word of the Lord, amen, this is the one and only, if your body's telling you something, like medicine or doctors, like they're also not infallible either at the same time. So
yeah, and they've been trained into a very specific system, because you could see one doctor who's trained in Western medicine and they would say one thing, and then you'd see a naturopath who's trained in a completely different system, and they're going to tell you two totally different things. So for these episodes, we want to keep them about 30 minutes. We're at 30 minutes. So what we will do is we will definitely do another one. We have more questions actually that we will come to, But please, if you have questions for me that you want to submit, you can, submit them through Instagram or even on Facebook, and also on the podcast through Buzzsprout. We have a place where you can it's called fan mail. Basically, you can submit questions there, and I am going to be doing these episodes regularly to answer your questions in the best way that I can. So thank you everyone for being here. And thank you, Jess, so much for being here with me for this episode.
Absolutely. Thank you.
Thank you for joining me on Born to Heal. It's been a privilege to share this time with you. And I hope that today's episode has offered you valuable insights on your journey toward optimal health. Please consider subscribing, sharing this podcast with your friends, and leaving us a review. To learn more about how you can work with me, please visit katiedeming.com. You can find additional resources in the episode show notes linked below, and remember to join us next week as we continue to explore more holistic approaches to healing. Until then, this is Dr. Katie Deming, reminding you that just like me, you were born to heal.